my name is Jennifer Nelson, and this is my head-to-toe assessment for Advanced Health Assessment. And my patient today is Kate Messenger. So thank you for being my patient. So Kate, what brings you in to see us today?
I need to establish a primary care provider.
Okay, so part of establishing a primary care provider is we're just going to do a good thorough assessment on you, do a head-to-toe assessment, and check out all the different systems and then just make sure that there's no problems there and that you're in good health. So tell me a little bit about yourself. Do you have any medical problems that we should be aware of?
Not that I'm aware of.
Good. And what about your family, your mom, your dad, your grandparents?
My dad has hypertension. My grandpa died of lung cancer from smoking. And my grandmas both have diabetes type 2.
Okay. And what about brothers and sisters?
My brother has not informed me of any of his issues.
Okay, that's good. What about medicines? Do you take any prescription medicines every day?
No, I do not.
Okay. What about any supplements or over-the-counter medicines?
No.
Okay, good. And what about surgeries? Have you ever had any operations?
Yes. I've had 2 C-sections.
Okay.
I've had abdominoplasty. I've had a knee surgery and an appendectomy.
Okay. And when was your knee surgery?
When I was in high school.
Okay. When did you have your appendix out?
When I was in college, so 2000.
And what years was your C-section?
I had one in 2001, one in 2006.
Okay. And when was your abdominoplasty?
4 years ago.
Okay. All right. Can you tell me when was your last pap smear?
2 years ago.
Okay. And you're not old enough to do routine mammograms yet, but have you ever had a mammogram?
No, ma'am.
Okay. And do you practice self-breast exams?
Yes, ma'am.
Okay, good deal. And how many pregnancies have you had?
I've had 2.
Okay. And 2 live births?
Yes.
Okay. And when was your last period?
Today.
Today. Okay, good deal. So, so what we'll do now, we'll just move into the head-to-toe portion of the assessment. So before we started the video, we checked your vital signs, and your blood pressure was good. It was 111/71, and your heart rate was, resting heart rate was at 62, which is perfect. Respirations were at 16, and you had a temp of 97.9. So all vital signs were in normal limits. Oh, and your pulse ox was 98%. So all vital signs were in normal limits, so there's no concerns with that. One of the things that we also did was we checked your vision, and your vision was 20/20 with your contacts in, and that would be normal for you, correct?
Yes.
Okay, good deal. So checking the vision is part of our cranial nerve assessment, and that checks cranial nerve number 2, which is your visual acuity. So what we're going to do to kind of simplify things a little bit is we will start off by checking your cranial nerves. And so we'll start with cranial nerve number 1, which is smell. And so what I'm going to have you do is just clog one side of your nose. All right, so that nostril's good and clear. That one's good and clear. So I'm going to have you close your eyes. All right, and tell me if you smell anything.
I smell lip balm.
Lip balm, lavender.
Yeah.
All right, you can open your eyes back up. So cranial nerve number 1 is intact with her. It smells like wax. Sense of smell. So we already checked visual acuity, which is cranial nerve number 2. So we will move on to cranial nerve number 3. And so I'm going to check pupil response. So I'm going to have you just look at my nose here. And her pupils are equal, round, reactive to light from a 3 down to a 2. So the next thing we're going to do is check her near response. And so what I'm going to have you do is just follow this little pin here in. And no abnormalities noted there, no nystagmus or anything noted with that. So next I'm going to check her extraocular movement. And check her extraocular movement. And so I want you to, again, just look at my nose and tell me when you see my fingers.
I see your fingers. I see your fingers. I see your fingers.
Okay, so cranial nerve number 3, 4, and 6 are both intact with extraocular movement. So next we're going to check cranial nerve number 5, which tests the trigeminal nerve. So I'm going to grab some gloves. going to have you do now is I'm going to have you close your eyes, and I'm going to touch your face, and I'm going to have you tell me if what you feel is sharp or dull.
Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp.
Okay, so she got all of those right as far as testing her sensation. So next I'm going to have you clench your jaw really tight for me. And she's got good muscle tone in her jaw. I'm going to have her open and close her mouth, and I'm going to be just checking the TMJ joint there for any popping or clicking. So that's normal, but not part of the trigeminal assessment. Again, going to check. You're killing me. Going to check cranial nerve number 7. So I'm going to have you puff out your cheeks. Don't let me close them. All right. Now stick your tongue out, side to side. All right. So she's got good movement of her tongue on both sides. I'm going to have you frown and smile. Smile real big. Show me your teeth. Okay. And I'm going to have you close your eyes real tight and don't let me open them. Okay. All right. So cranial nerve number 7 is intact with that. So next we'll move on to cranial nerve number 8, which is going to be testing her hearing. So I'm going to step back over here and I'm going to whisper a word, and I want you to tell me what that word is.
Dog.
Okay, so she passed that, the whisper test. Next, we'll do the Weber test, and we'll check for bone conduction. Tell me if you can feel that.
I can feel it.
Okay, and you can hear it.
I can hear it.
Okay. So next, we'll do the Rhine test, which will check air conduction and bone conduction as well. Can you hear that?
I can hear it. I can feel it. I can hear it.
Okay.
I can hear it. I can hear it. I can
Okay.
feel it.
Okay, so cranial nerve number 8 with hearing is intact. So next we're going to move on to cranial nerve number 9 and 10. I've been listening to her voice the whole time we've been in here. She has no shakiness or hoarseness noted to her voice. So I'm going to have her just go ahead and tilt her head back, give me a great big ah. Say ah.
Ah.
I see an equal rise and fall of the palate. The uvula is midline. And her gag is intact. So cranial nerve number 9 and 10 are intact. So next we'll move on to cranial nerve number 11, which is I'm gonna have you just turn against resistance there. Turn your head into my hand there, okay? And then I'm gonna have you, all right, and her trapezius muscle is good and intact, and I don't see any atrophy of the trapezius muscle. I don't see any fasciculation of those muscles there. Again, cranial nerve number 12, her speech has been very clear. I already had her stick her tongue out. That was part of cranial nerve number 12, and she had good control of her tongue. So cranial nerve would be intact for her. So the next part of our assessment, we'll move into the head to toe portion. So we'll start with her head, and I'm just going to start out by inspecting. I don't see any abnormalities to her face. I don't see any scarring. I don't see any signs of rashes. Her color is good and even. I see just a mild little acne breakout, which is probably related to her menstrual cycle. Don't see any abnormal hair growth either. So next I will palpate. So tell me, do you feel any pain here with the sinuses? So she has non-tender sinuses, which is good for her sinuses. So next I'll move on to assessing her eyes. So I already checked her pupil response. Her pupils were pearl. Again, when I was checking the extraocular movement, I wasn't noticing any nystagmus or anything like that. So next I'm going to take a look at her optic disc and her retinas. That also is part of cranial nerve number 2, where we check the visual acuity. But now we'll take a look inside of her eye and see if we see any abnormalities. So I'm going to have you look straight ahead. And I can easily see the retinal veins. I can easily see the optic disc, and I don't see any abnormalities in the eye. Right eye. again, you can easily see the veins and the arteries. Don't see any abnormalities there, and I can see the optic disc. So no abnormalities noted on the ophthalmoscope exam. Her sclera is white, and I also don't see any abnormal tearing or drainage coming from her eyes either. So next we will move on to her nose. She did pass cranial nerve number 1, so she did have good smell. So next we'll just take a look in her nose, and we'll just make sure that there's no polyps. So she's got good pink mucous membranes. No signs of irritation or infection going on. And next we'll take a look in her ears. So I'm just taking a look at her ears. I'm inspecting them. She has pierced ears. I don't see any signs on the external ear of redness or infection. So I'm just going to pull back on the upper ear here, take a look. And I don't see any wax. And she's got a nice clear TM. Again, looking at her left ear, again, she's got a pierced ear. I don't see any redness or irritation to the external ear. Take a look, just pull back here, take a look at the TM. Again, she's got a nice clean ear canal, no excessive wax, and clear TM. Next, we'll take a look at her mouth. We already did part of her assessment by checking her palate and checking her uvula. What I'll do now is just have you say "ah" for me. Ah. I don't see any white patches. I don't see any sores in the mouth. I don't see any broken teeth. I don't see any cavities. Her tongue is nice and pink. Don't see any sores. Do you have any pain or anything in your mouth? Any problem eating? Any loose teeth?
No.
Okay, so everything with her mouth is good. Next we'll move on to her neck. And so what I'm looking at here is to see if her trachea is midline. I don't see any abnormalities with her trachea. I'm looking at her jugular veins on either side. I don't see any pulsations or anything in relation to her jugular vein, so that all looks good. I'll just reach up and gently feel on one side, feel her carotid pulse. I'm not feeling any brewery or any pulsation there. And I'm not feeling one on the right side either. So carotid pulses feel good. So I'll step around behind you and take a feel of your trachea. So I can feel it on either side, or your thyroid. I can feel that on either side of your trachea. Go ahead and take a swallow. Her thyroid is easily palpated, no nodules or lumps noted. Go ahead and swallow again. And her thyroid is easily displaced to either side, again noting no nodules or lumps to her thyroid. So while we're back here, I'll go ahead and just take a look at her back. Again, noting those trapezius muscles, don't see any atrophy or anything there, don't see any fasciculation, which would make me suspect an issue with her cranial nerve. So I'm just taking a look here. I don't see any scars. I don't see any discolorations. I don't see any moles that would be concerning. Don't see any issues related to that. I see no curvature of the spine. And we'll go ahead and just take a listen to her lungs here. Big breath in and out. Go ahead and cross your arms across your chest for me. There you go. Big breath in and out. Listening for any wheezing, bronchi, crackles. And she's got nice clear lung sounds. While I'm back here, I'll go ahead and just palpate or percuss her kidneys and see if that causes any tenderness. Does that hurt at all?
No, ma'am.
Okay, so no tenderness to her kidneys while we're back here. So I'm going to have you go ahead and lay back. All right, so I'm going to go ahead and again inspect and palpate the front of the chest. Normally we would pull down the gown for this, but we'll skip that part today. We'll go ahead and look for symmetrical chest rise and fall again. We'll go ahead and palpate pulses at the second intercostal space to the right and the left of the sternum. Again, we'll feel for the PMI point down in her abdomen, pulse of maximum impulse, and that's easily palpated as well. We'll go ahead and take a listen. We'll listen to lung sounds, and then we'll also listen to heart sounds. And then for just fluidity of the assessment, I go ahead and we'll listen to the abdomen as well and get all of that done at once. Just big deep breath in and out. Big deep breath in and out. Her lung sounds are clear, so we'll go ahead and listen to her heart sounds here. She's got a good S1, S2, not hearing any rubs, any muffling of the heart sounds. She's got good, clear heart sounds. Go ahead and have you step forward and lean forward, checking for tricuspid valve murmur. And none is noted there. Go ahead and lean back again. And I'll go ahead and listen to all four quadrants of the abdomen for bowel sounds. And she's got good bowel sounds in all four quadrants. I'll go ahead and use the bell of my stethoscope and listen over the aorta. Listen for any bruits. None are noted. I'll listen to either side of her belly button, just below where I listen to the aorta, to listen to the iliac arteries. Again, no bruits noted. And then just a little bit further down from that to listen to the femoral arteries. And no problems noted there. So we'll go ahead and take a look at her abdomen. Just lay it down a little bit flatter here. So again, inspecting her abdomen. Again, I'm looking for any discoloration, any rashes. I do note the C-section scars, a piercing, just a couple of stretch marks related to pregnancy. I don't see any moles or anything that would be of concern. Don't see any lumps, don't see any odd pulsations, not knowing she's got a nice flat abdomen with no, looks like no retained fluid or anything like that. So next we'll percuss her abdomen, taking note if it is dull, that would be over a solid organ or a mass, and tympany would be over any hollow, gas-filled or hollow organ. So again, just noting the dullness over the liver and in the spleen area, and then tympany in the mid-abdomen there. So next we'll palpate. I'm going to watch her face for any signs of grimacing or pain. Do you have any pain when I press? So I start off by pressing nice and light. I'm not noticing any lumps or pulsations in her abdomen. So what I'll do now is I'll palpate the edge of the liver by having her take a nice deep breath in and out, and then I can easily palpate the edge of her liver there. And we'll do the same thing over here, nice deep breath in. You can easily palpate her spleen on this side as well. So we'll just take a nice fill over here and try and isolate the right kidney. And we'll take a fill over here, again, pressing together to try and isolate the left kidney. And I don't feel any abnormalities as far as her abdomen goes, and she has no pain with that assessment. So next, we'll move on to her extremities. And what I'm going to do is start out, actually I'm going to raise the head of the bed up just a little bit. We're going to go up to about 30 degrees. Go ahead and lay back. And we're going to start at the top and work our way down. We're going to start off by checking her for JVD. So I have her head of the bed at 30 degrees. Head of the bed at 30 degrees. And I'm going to take my ruler. I'm going to place it at the sternal notch. I'm going to look for the highest point that I see pulsation in her jugular vein. And I'm going to measure that across, and that is at about 2.5, which is normal. Anything less than 3 is normal. And we'll just check the other side here just to make sure again. And again, we're at about a 2.5 on the left side as well. So that's all good. So now we're going to check her extremities. Alright, so again, I'm looking at her extremities. I'm looking for any abnormal colorations. I'm looking for any scars. I'm looking for any moles or that could be concerning, or any wounds that she might have. I know some scarring to her left knee from the surgery that she told me about. I don't see any other abnormalities there. I'm going to start out by checking her brachial pulses. Those are nice and strong. Check her radial pulses. Again, nice and strong. Alright, now I'm just going to check her strength in her extremities. Squeeze my fingers nice and tight. She's got good grip strength. I'm going to have her pull against me and push against me. And she's got good strength on both sides. We'll go ahead and feel the popliteal pulse. And she's got good pulses on both sides. We'll check her pedal pulses. She's got nice, good pedal pulses, and the posterior tibial pulse is also good. And adjust that down just a smidge. All right. So next, I'll have you lift your leg. Good job. Lift your leg. So she has good strength there. Go ahead and press down like a gas pedal. Pull up towards your head. And she's got good strength there as well. And we'll check her, have you set up on the side of the bed real quick. We'll just check your reflexes, and then we'll be about done. Alright, so I'm going to have you take your hands, do this, pull across, give yourself some tension. There you go, and cross your feet. And so her reinforced knee reflex is good. You can't really see that. Alright, so next we'll check her reflexes in her arms. She's got good reflexes there. I'm going to adjust the camera down just a little bit so that you can see the check regular knee. Alright, and so she's got good knee reflexes as well. And just for the camera, so we'll, if you'll do this one again, we'll just repeat that one since we didn't quite get it. Okay, so good reinforced knee assessment. So that concludes our head-to-toe assessment. I would say that all of our systems are working well. As a new patient, I would probably want to set her up for just some baseline blood work, set her up with a chemistry panel and a CBC count. Would also want to check a fasting glucose as well as cholesterol test just to make sure that's good, and check a urinalysis just for good measure as well. So that would conclude our head-to-toe assessment and her establishing herself as a new patient in the doctor's office. So thank you very much for being my patient.